6-minute walk test with a special consideration for breast cancer patients. Benefits of the 6-minute walk test. The 6-minute walk test is easy to perform and can be administered almost anywhere. It is ideal for breast cancer patients because it does not put a strain on the arm or shoulder area, which is the area mostly affected. Also, the test can be used to track the progress of the patient's functional capacity. The setup for the 6-minute walk test includes 2 cones 30 meters apart with the starting line indicated at one of the cones. The ground should be marked with tape every 3 meters. 1 full lap will be equivalent to 60 meters. The equipment needed for the test is as follows: a stopwatch, cones to mark the turnaround points, a chair in case the patient needs to rest, data collection sheets, a blood pressure meter, a phone, oxygen, a defibrillator, and some water for the patient. Always remember safety first. If you notice any of the following problems with your patient during the test, make sure to stop the test immediately. Look for chest pain, shortness of breath that has become intolerable, cramping of the legs, staggering, profuse perspiration, or the patient's appearance has become very pale. Prepping the patient. First, it is important to make sure that the patient is wearing comfortable clothing and shoes that are appropriate for walking. If the patient requires walking aids, such as a walker or cane, they may be used during the test. Any current medical regimen that the patient is on should be continued. Also, it's important that the patient has not performed any vigorous exercise 2 hours prior to the beginning of the test. Have the patient seated 10 minutes before the testing begins. Record the heart rate and the blood pressure. Instructing the patient on the aspects of the test. Here is a sample instruction that could be given before the patient begins the test. The purpose of this test is to walk as far as you can between the 2 cones within a 6-minute time limit. Because you will be walking for 6 minutes, don't be surprised if you run out of breath or become tired. You may stop or slow down to rest any time during the test, but begin walking as soon as you feel comfortable. Also, making sure when walking around the cones to avoid any hesitation. Tell the patient you're going to demonstrate walking a lap around the cone without any hesitation. Make sure the patient knows that 1 full lap is recorded once they have reached the starting line. You should be counting the number of laps that they make within the 6 minutes. Remind them that the purpose of the test is to view their distance, not their speed, so make sure they don't run or jog while performing the test. Lastly, let the patient know that whenever they are ready, they may begin. Remember that at any time during the test, the patient may need to rest. If you see the patient begin to struggle, bring over a chair and allow them to take a break. As soon as they feel they are able, allow the patient to proceed with the test with the remaining time. When the 6 minutes are up, instruct the patient to stop walking. Walk over to the patient and mark with tape on the ground where they ended the test. Allow the patient to rest in a chair and drink some water once they have completed the test.